Hi, everybody. My name is Diego Grinman. I'm a postdoctoral associate at Yale University in the US, and I also an editorial member of HubLE. And we are here today in this opportunity with Albert, who presented his work at the Australian and New Zealand Bone and Mineral Society 2021 meeting. So, Albert, do you want to introduce yourself to the HubLE audience?
Thanks so much for having me here. So my name's Albert Kim. I'm hailing from Sydney, Australia, and I'm a budding clinician researcher, and I hold the dual position of a final year of endocrinology trainee, but I'm also a first-year PhD candidate at the Garvan Institute, and we look at changes in osteoclast biology with osteoporosis therapies.
Oh, beautiful. So what are you presenting particularly in this meeting, Albert?
Yeah, so we were able to present our work on the optimal use of sequential zoledronate following denosumab discontinuation in our mouse models.
Okay, so what are the key findings of your work? What did you find after doing those treatments with zoledronate?
Yeah, so using our mice models, we found that serum trap actually precedes the loss in bone density that occurs after rank ligand inhibition comes off, and that given zoledronate at this time was able to prevent the rebound bone loss. And we also found that actually giving 2 doses of zoledronate was superior compared to giving a single dose, which was kind of an exciting finding.
Right. So what about the clinics nowadays? I mean, is that being used like 1 dose of zoledronate after the denosumab discontinuation? Are they giving 2 doses just like you are doing the treatment?
Yeah, so that's a really good question. And because right now, we don't really know what the best way to transition from denosumab is. The current recommendation is to give a single dose of zoledronate at the end of treatment and monitor these patients very closely. And the latest guidelines coming out of Europe is to consider giving a second dose, so which kind of is what we're mimicking in the lab.
Okay, so do you think that this could have like an immediate impact in the clinic and your work?
I think at the moment we need a bit more information especially about how serum markers change in the clinic. And that's actually part of what we're hoping to do in the coming 12 months, looking at patients in the clinic who stop and start denosumab and looking at how the serum markers change and what happens when we give zoledronate in these patients as well. So watch this space.
Wow, so that's really exciting working with patients. That's a big step for your career, right?
Definitely.
And what are you thinking to do next? I mean, you said that you're a PhD candidate. Are you thinking you're staying in the academia in the future? What are your plans for you?
My short-term plan is to finish my clinical training this year and become a fully qualified endocrinologist, and that's quite exciting. It's been quite a long journey. And the longer-term plan is to become an academic researcher in the clinical field, hoping to do both bench-based and bedside-based science in improving osteoporosis therapies for our patients.
Right, so you're on the road now.
We'll see how we go.
Okay, so Albert, thank you so much for your time. My question is, do you have a Twitter handle that you want people to follow you if they want updates on your research?
Yeah, I'm a complete Twitter newbie, but I thought I'd give this a go during our ANZ BMS meeting. My Twitter handle is at AlbertNdoc, ANDOC. So you can follow me on Twitter, and I'll try to post a little bit more. And if anyone has any tips about Twitter, I welcome that as well.
Fantastic. Give Twitter a chance. All right, Albert, thank you so much. And thanks for the HubLE audience, and keep on track because there's more science coming on. Thank you.
Thanks, Diego.